The temporomandibular joint, or the TMJ, is a very complex joint that's located just in the front of the ear. It acts like a sliding hinge and connects your lower jawbone, or mandible, to the temporal bone of the skull. The TMJ is a unique joint because of the articular disc. The articular disc is made of fibrous connective tissue that lacks nerve endings and blood vessels, and therefore is insensitive to pain. It acts as a cushion between the two bones. Oftentimes, the articular disc is displaced or damaged. As this happens, the tissue that's supplied with blood vessels and nerves is pulled between the two bones, which can be painful. The dislocated disc can form an obstacle when opening and closing the mouth. The condyle has to jump over the back end of the disc, which can create a clicking or popping noise. In order for the mouth to close, the condyle slides back over the disc and another click or pop can be observed. Temporomandibular disorders are common and cause pain in the joint or in the surrounding muscles that help control the jaw's movement. Your doctor will help determine where the pain is coming from and provide various treatment options to improve the function of your jaw.